In an exclusive interview, Mr. Bire told MTV News that funding constraints has prevented the National Aids Council Secretariat from implementing all programs in the last 2 years. Although the national government has allocated some funds, it is purely for operations.
Unfortunately, the government is not, it's given money for operations, which is to do with salaries, but it's not given our program budget for the last 2 years. So that's the message,
Mr. Bire also revealed there is a lack of coordination between the National Health Department and the National AIDS Council Secretariat.
There's some lack of communication, and the government is giving money to health, but not really for our work.
While appreciating donors' effort, he explained their funds are shared among implementing partners of known government organizations and churches.
Well, we are coordinating that as well, but it goes directly to not to government, but to the implementing partners, Save the Children and a few of the churches who are doing the service delivery. So we appreciate the donor partners funding, but it goes straight to them, not to our organization.
Accurate database system still remains a challenge. The National AIDS Council Secretariat, as the custodian, only reports statistics from patients who visit testing sites, considering many infected still living in rural areas.
Our real threat is in the rural areas, where the prediction is that probably there's not much, but that's just based on what we are saying. But we need to go there and find out.
Mr. Bire appealed to the national government to ensure funds are released for this sole purpose.
There's a gap, which is the general population and in the rural areas, and that's the role of the government. So we're trying to convince the government to help us to do more in that one. If we cared about people in the rural areas. And
Fabian Hakelitz, National MTV News.